Hi, so welcome to this webinar that we're recording today. So some of you might know I'm Dr. Louise Newson. I'm a GP and menopause specialist in Stratford-upon-Avon, UK. I'm a physician, so I'm a doctor who specialises in menopause, but also I'm very interested in disease prevention. So for most of us, we don't want to be going to our doctors. We want to be having a healthy life. It's not just about how long we live for, it's how healthy we are. And so good menopause care can reduce risk of various diseases, which we can talk about. But I have with me today Gordan Lauc, who is a professor of biochemistry and molecular biology. And he's also the director of GlycanAge, who I recently connected with. So it's really lovely to have you here, Gordan.
Hi, thank you for the invitation.
So just explain, if you may, what GlycanAge is and what glycans are, because it's something that a lot of people, including doctors, actually haven't heard of.
So glycans are a set of molecules which are being covalently attached, so firmly linked to proteins. And they regulate activity of many different proteins. And one type of proteins which are being regulated by glycans are immunoglobulins. So the antibodies which are helping us to fight infections, but also these glycans balance the immune response. So if antibodies are made to be pro-inflammatory, they cause a kind of explosive reaction. They destroy the target. But these same antibodies can be made to suppress inflammation, so to control antibodies against some antigens we would like to tolerate, like the food we eat or things we breathe. And this is regulated by glycans. So addition of these covalent structures called glycans. And we are doing large studies on glycans. We analyzed over 150,000 people through the project called the Human Glycan Project, where we are trying to understand what glycans do and how do they regulate different physiological conditions. And one of the things we learned among the first studies we did was that glycans on immunoglobulins change a lot with age. So as we are getting older, our immunoglobulins become more pro-inflammatory, while when we are young, our immunoglobulins are actually suppressing inflammation. And we lose that as we are aging.
Yes, which is very interesting because a lot of times we think about immunoglobulins or inflammation as infection, but it's not just infections, is it, that inflammation is very important for?
So antibodies as a weapon which we developed through the millennia is basically aimed to prevent infection. So you have bacteria coming in, eliminate it. You have viruses, kill them with antibodies. But also these same antibodies can make a mistake. So they can attack our own cells. They can consider food to be an enemy. So then we can have food allergies. We can have autoimmune diseases. So antibodies can, on one end, be extremely important. They protect us. But if they make a mistake, they can be very damaging. And this is why this regulation, which is being done through glycans, is extremely important. For example, many people would have antibodies against different food. So anything we eat, we will make antibodies against it. But these antibodies are silenced with glycans. So they don't cause inflammation. They don't cause damage. They're there, but they don't do any damage.
But if the glycans aren't there in the same way, then they can cause damage.
They could. So for example, in some diseases like rheumatoid arthritis, we believe that the first step to develop autoimmune disease is to make autoantibodies. But many people have autoantibodies and they do not develop disease. Only when glycans change, when something like a glycan switch happens, then these antibodies become pathogenic and they start to cause disease.
Which is very interesting. And it can be associated with other diseases, can't it, such as heart disease and maybe dementia, also obesity. I've read that it can be associated with this sort of low-grade inflammation that's wrong in the body. Is that right?
So immunoglobulin glycosylation, glycans on IgG, are one of the ways how we balance low-grade chronic inflammation. So when we are young, we are able to suppress it with these glycans, and as we are aging, we are losing this capacity to suppress low-grade chronic inflammation. And low-grade chronic inflammation is underlying cardiovascular diseases, but also some other problems. Regarding obesity, it's hard to define cause and consequence there, because we know that obese people have more pro-inflammatory glycans, but I would think it is more obesity driving the IgG glycosylation, because if people go on a diet, and especially if they do something radical like a bariatric surgery, we see that glycans revert and go back toward the younger glycans, more immunosuppressive glycans. So I think obesity is one of the examples which show how our lifestyle, changing our glycans, then make us more susceptible to different diseases.
Yeah, and lifestyle obviously is something that we can all change and optimize with the right motivation. It's really important, and we know that, don't we? We know that not eating processed foods and not smoking and exercise can have so many effects and probably affect glycans as well. But for me, obviously, as a menopause doctor, all I do is think about hormones, so estrogen and testosterone actually in women. And tell us about what you've found with estrogen and glycans. Is there any link?
So we are trying to understand what are the mechanisms, molecular mechanisms, which regulate IgG glycosylation. And something we learned from our population cohorts is that as women are approaching the menopause age, so in the peri-menopause period, their Glycan age, or these bad glycans, are increasing rapidly. So, of course, the first suspect is estrogen. So when we know that we are starting to lose gonadal hormones, including the estrogens, we see the change. So what we organized was a very interesting randomized placebo-controlled trial in collaboration with one group in US, where they had 36 young women chemically induced to the menopause. So they used chemicals to stop the production of gonadal hormones, including estrogens. And then when they checked the hormone levels, so the woman who had this intervention, their hormone levels fell to the menopause, to post-menopause levels. And then, so these were 36 women, and then they were randomized to either receiving the estrogen replacement, the estrogen patch, or they got a patch, but with placebo. And the woman did not know whether they have an estrogen patch, so the hormones return to the normal level, or placebo. And what we noticed is after a month of this intervention, when the hormones went down to the postmenopausal level, women receiving the placebo, so who did not get the hormone replacement, their Glycan age increased by approximately 30%.
Wow.
So they got 10 years older than what they were on average. Some were responding more, some were responding less. They got older. But the woman who were receiving the estrogen supplementation did not. So the supplementation of estrogen protected this woman from having the change in immunoglobulin glycans, which is promoting inflammation. So in a way, estrogen supplementation is preventing inflammation in young women. What we are currently doing, we are doing experiments to see the molecular pathway. So what happens after estrogen binds to the receptor? Where is the signaling pathway? This is something what we are exploring now. And something we are very interested in is, would this also happen in a normal menopause? Because this experimental setting was chemical-induced menopause, which can be saved with estrogen. But when there is a normal menopause, first the question is, will it help at every time point? Or do you have to give it before the menopause? Or if you give it in the peri-menopause period, or even if you give estrogen 10 years after the menopause, will the change still happen? This is something we are currently really interested in, and we are trying to organize a study where we would have a woman normally entering the menopause with and without the hormone replacement.
And it, I mean, there's a lot said about that that's very interesting, and partly that it's working so quickly. So a month is a very short period of time for estrogen to work so quickly. And I'm sure because they were so newly menopausal, if you like, I'm sure that makes the difference to the way the receptors are responding to the estrogen. And we know from big studies in the past that women who have an early menopause have an increased risk of diseases that are associated with inflammation, such as heart disease, type 2 diabetes, dementia, osteoporosis, and cardiovascular disease. So it does all sort of make sense. And we know actually that estrogen is one of the best anti-aging treatments we have. And when I say anti-aging, it's not about not having wrinkles, it's about not aging the whole body, the whole system. And for many people who've heard me talk before, we know that it's not natural to live for decades without our hormones. We're not designed as women, evolutionary, to live for 3, 4, 5 decades without estrogen. And we need to shift this whole perception of the menopause as something that just causes a few symptoms to something that actually has potentially detrimental effects on our body because we don't have the hormones. And this whole link with the glycanation and the way that it affects immunoglobulins, the way it affects inflammation actually makes sense. And even there might be an association with some types of cancer, because we know that women who take estrogen in the long term have a lower risk of death from all causes, including cancers as well. And that's something that is not really thought about as well. So there's a huge amount, isn't there, that needs to be looked at.
So we still know very little about the way how our body functions at the molecular level. And when you say 1 month is a short period, well, you were thinking about the normal menopause, how things are happening slowly. What we did was experimentally just cutting down the hormones, which was a different type of a shock. This is why I said we also have to see whether the same thing happens in women going through this normal process. And I completely agree with you that evolutionary, we were not made to live as long as we live today, because there was no genetic pressure to stay alive after you have your kids. And this is why we have to think about the molecular processes, which are probably not evolutionary optimized for such a long lifespan, and then try to tune them into returning to the normal. So I do think that the estrogen is one important thing. We haven't done much research on estrogen. We started it relatively recently when we developed this GlycanAge concept and then learned that estrogen is important there. But it probably affects also many different things. So I think it's extremely important to look at people, at as many people as possible, because we are all different. So we don't all respond in the same way. And it probably also depends on our other habits, like a diet or even microbiome or who knows what. So we still have a lot to learn. And this is why doing research is fun. So we are learning new things all the time. And I think it's extremely important that this research actually helps people. For example, as you mentioned, we know which things are healthy, but the majority of people do not do it. They don't do it because the payback comes after 20, 30 years. So, I'm not going to change my habit today or skip that extra cake or whatever, because I will be better in 30 years. And the idea of the GlycanAge as a test is that it can give you early feedback. So you change your lifestyle today, lose weight, stop eating processed food, take hormone replacement, and then after 2 or 3 months, you can see feedback. You can see glycans are becoming better. They're not causing damage anymore. And then maybe more people would be willing to do something which is hard. And
I think, and that's so important, isn't it? Because especially when we're young and healthy, I see the way my teenage children live, they're going to live forever. They don't think about long term. And, I know certainly when I was a student and smoking was all about lung cancer. And then I was a student and I was helping people with chronic respiratory disease. and looking at these, we used to call them, well, we still do, respiratory cripples. They are cripples because they can't walk, they can't move because their lungs are so bad from smoking. And I never realized that. I just thought it was you get cancer and you die, so it doesn't matter. You could smoke and you'd live until you died, but you wouldn't have this prolonged illness. And so we need to think, but it's very hard, like you say, to, none of us want to be obese, none of us want to have heart disease, but we don't think about what we're going to be like in 20 years' time. But to have a test where we can see that sometimes it's actually very simple things in our lifestyles can make a difference and start to make a difference, I think is really encouraging. So tell us about this GlycanAge test then. How difficult is it? What do we have to do?
So this test was developed based on our research on IgG glycans on the large cohorts, where we learned that by simply combining a couple of structures in immunoglobulins, we can calculate something we call a Glycan age. Glycan age is the index which is increasing with chronological age, so it correlates highly, but not absolutely. So, and the difference between the Glycan age and the chronological age is generally explained with a lifestyle. So people living a healthier lifestyle will age slower than people living unhealthier lifestyle. So we can have a person who is chronologically 50 and the Glycan age could be 30 or it could be 70. And we are seeing people like that. And often I got asked, why would I like to know that? I don't want to know that I'm 20 years older. And then my answer would usually be is look at it as an early warning signal. Imagine you are speeding and there is a speed trap, police waiting for you to catch you if you are speeding, and somebody gives you warning 1 kilometer ahead and say, there is a speed trap, slow down. So you slow down and then you don't get a ticket. When you translate this to the real life, what usually makes people change their lifestyle is either heart attack or stroke.
Yeah.
So when they got hit really hard, if they survive, they try to live healthier. But then it's usually already too late. So what we are trying to do with this test is to give an early warning. Some molecules in your body, which are doing you damage, are high. And the best thing about it is you can change it. So what we see people changing lifestyle, people starting to take different interventions. It could be hormones, it could be some other supplements. It's not the same thing for everybody. So there is no a magic which works for everybody. But this test gives you a chance to get feedback. Are my efforts paying off? So if I control, for example, for me personally, my GlycanAge best responds to my weight loss. I start eating less. I start losing extra kilos. I do have few extra kilos. And then my GlycanAge starts to go down and not up. Then I don't know, usually when I have too much work, I get too stressed, then I start eating again. And then my GlycanAge goes up again. So it's a kind of objective measure, how you can quantify something we cannot see. Because when I look myself in the mirror, I'm the same like yesterday. I don't see the change.
Yeah, which is really, really important. And I think, I'm very interested in nutrition and our microbiomes. And, there's so much association and there's so much we don't know. But actually, like you say, to have an objective test, and it's a very easy test, isn't it? It's literally just 4 pinpricks of blood that go on a sort of blotting paper type circles, aren't they? So it's there are some blood tests where you are pinpricks, but you have to get quite a lot of blood. And I tried them because I was going to use them with some of my patients during lockdown, but it's actually very painful to get a lot of blood into a vial. But this is literally just a drop of blood, isn't it? So it's very easy.
Yes. So we did a lot of research trying to make this test as convenient as possible. So it's really 2 or 3 drops of blood. It's one usually, well, sometimes people are too gentle, and then when they do it to themselves, they just make a tiny little punch, and then you don't, but it's 1 or 2 or 3 drops of blood on a card. You dry the card, put it in a mail.
That's it.
And you get the result back. So it's really developed in a way to work simply. Yeah. And it is being sold as a subscription. So you can take a subscription for 1 test a year, 2 tests a year, 4 tests a year. So you can actually track you and see whether things you're doing are doing you good or they're doing you harm. So we think it's interesting and we think it's easy. And actually it's really, so this is very new test. It's on the commercial market for less than a year, couple of months actually. There was a lot of research being done. So there are many research cohorts which we studied, but just the direct to consumer, it's very simple, very recent, but it's really picking up. So people are now buying it in US, in Australia, in Canada, all around Europe. It's really interesting.
No, it's fascinating. And certainly what we want to do here with you is to see how people's glycanages change before and after taking HRT. And that's something we're just trying, but we're offering it obviously out to women because it's all life's about a choice, isn't it? But I think this is something that personally each woman will be able to see objectively, like you say, how this measurement might change. And a lot of women we see once they start taking the right dose and type of HRT, their lifestyle is so much easier to get better. They start to exercise, they don't have muscle and joint pain, they're more motivated, they're more interested in life. So they're more interested in cooking properly and they'll sleep better. And poor sleep, I'm sure, will affect glycans as well. So there's a whole plethora of things, but actually to do your GlycanAge and see that it's better than your chronological age is just really quite exciting, and to see how it can change. And we all need encouragement as well, but this is scientific encouragement. This isn't someone just buying us a cup of tea and a piece of cake because we feel good at the end of the week. This is actually something that will hopefully make a difference. And if it can really make a difference to as many women as possible to show we need to keep healthy, then that's got to be good.
Yes, and I think the way of doing this test under the guidance of somebody like you is the right way to do it. Because if you do it on your own, then the thing is, what do I do next? Precisely. But you, as a physician, would look at the GlycanAge as one of the components of the entire anamnesis you're going to do. So, and then you will see maybe for a given individual, you should increase the dose of hormones. Or maybe for some people it's working already. So it's just another tool which will help you evaluate what is going on. It's a not universal answer. No. So often I also get a question, why do you think your test is the best test of biological age? And then I say, there is no gold standard for biological age. Biological age is a kind of idea. It's not a carved in stone number. And the GlycanAge is one of the components. It's the age of your immune system. And if you keep your immune system at young age, meaning the immune system which looks like the immune system of a young person, this is good. Yeah. I don't tell you whether it's good 1, 3, 5, 9 on 2000. The number is not important. What is important is looking at the trend. Yes. So if you are aging, that's normal. But if you're aging faster than other people, that's not good. And if you're aging slower than other people, that's great. Yeah. So you get a number. Yeah, absolutely. And I think it's great because certainly as a physician, I am very holistic in my approach. It's not just about HRT. There's no point me taking HRT and smoking 20 a day and eating fast food every night for my supper. It's just not going to do it. And so the beauty of me seeing people and the training that I have is about holistic care. So all the time we can look at how to modify and improve our lifestyle. And I think this is something that will be very useful for a lot of women. So I really thank you for your time today, Gordan. It's been really interesting, and I hope it's given
people just bit of food for thought, really, thinking about glycans, which might be something they've never heard of and didn't even know they had in their body. So thank you for today.
Thank you. It was a pleasure.